Again, thank you so much for joining us. This is the Aligned Modern Health Digital Doc Conversation on Mental Health. We are joined today by Dr. Lamia Camel and Joyce Martyr, two experts in their field. And before we get started, we thought we would just take a brief moment to introduce Aligned Modern Health in case this is your first digital doc presentation with us. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider, offering expert care in both internal and external medicine. And we really take a look at the whole person, not just a symptom or a condition, to really get to the root cause of why you are feeling what you're feeling. We have 18 clinic locations in the Chicagoland area, and we also serve 8 states throughout the US via telemedicine. Our services include chiropractic physical medicine, which is supported by chiropractic care, clinical massage therapy, injury prevention and rehabilitation, and athletic performance support. We feature functional medicine and clinical nutrition, which is a really great way to look internally as to why you're feeling what you're feeling externally. This practice focuses on gastrointestinal and autoimmune disorders, bloating, constipation, fatigue, migraines, food sensitivity testing, hormone balancing, sleeplessness and insomnia, weight management, and nutritional counseling. We round out our services with acupuncture, which can be a really amazing treatment for physical pain, but also for some intangibles like stress, anxiety, depression, sleeplessness and insomnia, migraines and fibromyalgia pain, men's and women's health and fertility concerns, pregnancy support. We also offer herbal medicine, cupping, moxibustion, and a few other modalities that fall under the traditional Chinese medicine umbrella. Speaking of acupuncture, it is my pleasure to announce Dr. Lamia Camel, who is one of our presenters today. Dr. Camel, welcome.
Thanks, Janine, and thanks everyone for joining us today. I'm really excited to chat with my co-host here. So let me give you a brief introduction to myself, keep it very brief. So my name is Dr. Lamia Camel. I am the Director of Acupuncture at Aligned Modern Health. So I started our practice here a little over 8 years ago, and we've grown to the growth that Janine was talking about. So not only do I practice 1 day a week, I'm actually in one of our clinics right now. So I have some patients waiting. So thanks for moving today, guys. But I also work with our team to help grow the practice and educate more folks about this medicine. So that's why I'm really excited to be here today. I cannot get enough about talking about our medicine and teaching new folks about what we do. So in addition to that, I'm associate professor at Pacific College of Health and Sciences. I teach in their doctorate program there, certified in acupuncture, herbal medicine, and traditional Chinese medicine. Have my doctorate of acupuncture and master's in science as well. And bachelor's degree in chemistry and physics. So if you want to talk about quantum mechanics, we can chat about that too. We'll see where the day goes. From a clinical perspective, I'm very much interested in mental health. I blame/thank my mother. She's a psychiatrist. So I feel like those are the folks that tend to come my way, but sometimes they present in other ways. And we'll talk about the correlation and the connection between things like pain and maybe digestive issues or gut issues and psycho-emotional and mental health issues. So before we kind of get into the conversation, I'd like to introduce or pass the mic to my co-host here, Joyce Martyr.
Thanks so much, Dr. Camel, and thank you to Aligned Modern Health and all of you for recognizing the importance of mental health during these challenging times. I have been a licensed psychotherapist for nearly 25 years, and I've found my work to be emotionally, intellectually, and spiritually rewarding. It has been high honor to work with my clients and guide them through healing and recovery and self-discovery so that we can thrive and prosper. I think we all can benefit from counseling or therapy at different points in our lives. I'm a really passionate mental health advocate. No shame, no stigma. We all deal with mental health challenges at different times in our life, and help is available and effective. I'm the founder of Urban Balance, which is a national outpatient mental health company with 17 locations in 6 states. I've served several leadership positions in the counseling profession, including chair of the Midwest region of the American Counseling Association. And I'm a national keynote speaker and corporate trainer. I do a ton of mindfulness in the workplace trainings, mental health awareness in the workplace, mental health first aid for leaders and supervisors, and love spreading my message. And I'm most excited about my new book, which is The Financial Mindset Fix, a mental fitness program for an abundant life. It was published in July by Sounds True. And I'm really excited to talk with you today. I'm very aligned with Aligned Modern Health in that I very much believe in the mind, body, spirit connection. Years ago, I suffered a herniated disc. And interestingly, it happened at a time in my life where I was a new mom, and I had been saying to my loved ones, I need more support. And then my spine gave out, my back gave out, which really was a physical manifestation of my emotional state. So Dr. Camel and I have given a similar presentation in the past. We really share our passion for helping people recover and thrive in their mind, body, spirit wellness. And I hope that you find the information today inspiring and normalizing and helpful. So I'm going to hand it over to Dr. Camel to kick off our conversation. Thank you.
Thanks, Joyce. I love that a couple of points that you mentioned, I love that you mentioned this idea of normalizing. I think that, like I mentioned, my mother's a psychiatrist, so I never really saw psychotherapy. I never really saw therapy in general as something that was wrong. It was just a different physical biochemical thing going on, right? But that was not the case. Many people are like, oh, your mom's a shrink. Like, what does that mean? So I think it's this has been a tough time, and it's been a lot, right? These last couple of years. I think anyone who says differently is on some amazing drugs. And so it's been a lot. And I think that one of the most beautiful things that I've seen in practice is that because we're all going through it together, there is some sort of normalization that's happened, and there is some sort of community that's being built around that. That's one of the most beautiful things, but a lot has been going on. And I think from a mental health perspective, what I've been seeing clinically is a lot of folks who were go, forced to kind of stop and then pause and then go again, right? And that is not an easy or comfortable place for most folks, and that's something I've noticed in my clinic and in practice. When somebody's coming to get acupuncture, they're going to have to lay on the table for 15, 20, 25, maybe 30 minutes by themselves. And that can be a really scary thing. This is just a larger example of that, of us being forced to pause and reflect. And what it's done is brought things up to the surface. So on the positive side, now we have things we can work on, right? On the negative side, it can be really overwhelming. So in general, that's what I've been encountering a lot these past couple of years. And we've kind of gone through all these waves, right? And let's talk about kind of where we're at now, where I feel like we're kind of in the burnout phase. I don't know what your thoughts are on that, Joyce.
Yes, absolutely. Clinical burnout is definitely something that I'm seeing a lot in my practice and through my global corporate training presentations. We've been in a state of chronic transition and change and uncertainty, and that causes stress and anxiety for all of us. And I love, Dr. Camel, that you grew up in a household that really normalized mental health issues, because we all have mental health just like we have physical health. And it's a normal response to our genetic predisposition and our stressors, and also our support. And the higher our stresses are, the more self-care and the more support we need, which is why I saw Eric at Alignable yesterday for my acupuncture, because it was chiropractic care, acupuncture, and functional medicine that helped me recover from that herniated disc years ago. So I love that we both have this holistic approach and really normalizing that response. But definitely burnout is something that I'm seeing a tremendous amount of in my practice.
Yeah, and what's interesting is that, it certainly shows up from an emotional perspective, but we're seeing it physiologically from the physical perspective as well. So that story about how your back just gave in because you didn't have enough support is just like a perfect example of how we can understand Chinese medicine. I mean, realistically, we can't separate the mind and the body, right? Last time I checked, we all have necks. And so in them is this highway of communication, right? And so it's really impossible to separate the two. And so sometimes, it was interesting. The folks that I was seeing before the pandemic hit, a lot of what I was seeing was that when they'd come in, they already had some body awareness. And so they were already able to kind of quantify and qualify their feelings, right? And we were already kind of working on that. But other folks, maybe they were coming in because they were in extreme pain and they wanted to avoid going into the hospital. And obviously it was impossible to get in and all of that stuff. What we found is underlying all of that is always going to be something emotional, right? So sure, we'll work on your shoulder, but where's this really coming from, right? Like your spine didn't just suddenly give out. Yeah, pregnancy is not easy, but there's more to it than that, right? But now at the burnout phase, because from a physiological perspective, we've been in this fight or flight phase, this activation of our parasympathetic nervous system, where we're go, constant transition, like you mentioned. And transitions are natural and healthy and necessary, but a refractory period is also really appreciated, right? And I feel like many people have not had that opportunity, right? We go from, regular COVID to Delta, to Omicron, to who knows what's next. Omicron part 2 is what I read this morning. And it feels never ending. And what that's doing is just wearing us out physically and emotionally. But to me, the beautiful part of that is that we're all experiencing it together. And all of us have had this experience in our lives where we've grown by working together through tough times, right? We've all experienced loss at some point. It's sort of the beauty of a funeral, for instance, right? You're all together and remembering this human being, but also mourning together. And I think that's what a lot of what I've been seeing is people really mourning, but then coming from that and having regrowth. So all of these concepts are very much a part of Chinese medicine because they're really concepts that you can experience throughout the world, right?
Absolutely. Absolutely. And, I love that you're talking about, the emotional experience that we're experiencing and the grief and loss that we've all experienced during the pandemic. And some of us have lost loved ones during the pandemic. We've lost loved ones to COVID, but we've all had losses of our life as it was previously. And so that can trigger feelings of depression or anxiety. And again, I think we're all hardwired to respond to stress differently. I remember when I started graduate school at Northwestern, I was really worried that my professors were going to see that I deal with an anxiety disorder and that they were going to be like, you can't be a therapist, you have issues. Well, if there's anything I've learned from 25 years of being a therapist, it's that we all have mental health issues, and mental health issues are on a continuum. And we can move through that continuum within our lifetimes, within a day, within a week, depending on what's happening. And so at one end of the continuum is being in crisis and, having serious mental health concerns that might include, serious clinical burnout, a major depressive episode, suicidal ideation, and some severe mental health symptoms. And then we may be struggling or just surviving. When I've been giving webinars, most of the participants across the country through anonymous polling are saying that they're falling in that surviving or struggling categories. So if you're having difficulty during this time, you're not alone. It's a normal response to all this madness going on in the world. And we're exhausted and depleted. And I agree with Dr. Camel that the silver lining is that people are having honest conversations about mental health, which removes the shame and stigma. When we can admit that we're struggling, we're having a hard time, when we can talk about it, it normalizes it. And, I think we all can benefit from a therapist or counselor. It's like seeing a dentist or a doctor or a holistic health provider. It's like having a personal trainer for your mind and your relationships. And it can help you move to the other end of that continuum, which is really thriving and excelling. So mental health is not just about suffering and symptoms. It can also be about strengths and wellness, and about, having emotional intelligence, having self-awareness, having different coping skills so that you can be resilient at home and at work. And Dr. Camel talked about burnout, which is definitely something that many people are experiencing. According to the World Health Organization, 835,000 people are dying a year because of overwork and burnout. And things need to change. I named my practice Urban Balance because I believe in work-life balance, and we need to create that for ourselves. Many of us are returning to the workplace after working from home or having hybrid models, and that's yet another change that brings about some uncertainty. I want to share with you, I have a landing page that I'm going to share in the chat. And because today's conversation is short, I wanted to share, and I'm going to share it on my screen as well. This landing page will require you to enter your email address so that you can see the page. But once you're in there, I have copies of some of my slides from my mental health awareness trainings that I give. So if you're interested in more information for yourself or your workplace or your family, please access this landing page, and you're welcome to download the slides. There's a ton of resources and active links in there. I also shared some free exercises from my new book. That these are downloadable PDFs. If you want to work on your self-care practices, you want to work on accessing more support. Again, in my trainings, I found out that most people are struggling with accessing support and help. So be sure to check those out. I also write for Psychology Today, and I have a lot of blogs on things like, how to access more emotional support, how to cope with winter blues or seasonal affective disorder. So be sure to check out that blog. And I obviously am available if you have any questions. But I do want to speak to a couple of the diagnoses or issues that I'm seeing a lot that many of us are experiencing. Those include anxiety, depression, trauma, and burnout. So symptoms of anxiety might be racing thoughts, ruminating thoughts, second guessing, worrying about the uncertainty of the future, having physical anxiety or tension, headaches, stomach aches, sleeplessness and insomnia, something that I'm hearing a tremendous amount about, and panic attacks and overwhelm. And then depression, I think a lot of people think of that as having suicidal ideation or being really sad, but I don't think a lot of us realize that depression can manifest as irritability or agitation or anger. So if you're finding yourself less patient, or even if you're just feeling kind of blah, that can be a manifestation of depression. The pandemic is a global trauma. And we cannot process traumas like we do usual life experiences, and they get locked in our psyches and in our bodies. So psychotherapy practices like mindfulness and cognitive behavioral therapy and EMDR, other trauma protocols can help you work through that. And I think along with having a physical wellness practice like those offered through Aligned can really lead to holistic healing. What are your thoughts on that, Dr. Camel?
Yeah, I think I just love listening to you, Joyce, because we're treating the same things. So we're just looking at them very similarly, but just slightly different lens. I love this concept of a continuum because that's just it. We're not always going to be in one place. The body inherently is dynamic for as long as we're alive. And that's something I always like to remind our patients of, because you are going to experience tough times. That's reality, but you don't have to be stuck there, right? And part of you seeking out care means you're putting out the stimulus to try to shift things. I also, with therapy particularly, I love that not everybody, it doesn't have to just be because there are problems, right? It can just be for longevity and wellness and mental health for the long term, right? For that resilience, to build that resilience. And what's been really gratifying for me. So I've been in clinic this whole time. I didn't take a day off. I was in clinic more, in fact, during the pandemic. And what I've really appreciated is I've seen this transformation in folks where that you start with that fear, and then they started moving towards, and again, you'll come back to fear every once in a while, and we got the vaccine, everyone feels happy, and then suddenly, Delta comes, right? So you're going to have that wave of going back and forth. You're going to be riding that continuum. But what I've seen is that each wave that comes at them, they have more resilience, more flexibility, right? And it comes down to, it's a really clear concept in basic Chinese medicine, where flexibility is life, right? We have to learn how to be flexible. And if you're rigid, you will die, right? So if you go into rigidity is death, in fact, right? What happens when the life force leaves us, we're rigid. If there's a storm, the trees that are really big and thick and heavy and stalwart, they disappear, right? They crack. Those are the ones that fall on your car, right? It's those ones that have a little more flexibility that have that resilience, that are able to weather these storms. And that same thing has to exist within us. And in fact, what has been great is patients who had been seeing for years before, or even just for months before, who I had brought up these ideas of, mindfulness and meditation and, practices that slow them down. They were the ones coming to me who were like, okay, I'm ready to do that. Right? Like they were asking for it, which is really a beautiful thing. And sometimes, it's those tough situations that put the trauma in front of you and remind you that you are able to deal with it with the right community. So I love that you mentioned that too. I think that that is one thing that was really hard for a lot of folks early on. And what I'm seeing more of now is that people are finding their communities again, reconnecting with them, creating new communities. And that makes such a difference, because I think this idea of doing it all on your own is a joke. And if this, it is. And if this pandemic has taught us nothing, it has taught us that, right? We are much stronger together. And at every level, we've been seeing that live out. So it's been beautiful to see that these past couple of years, actually.
I love it. And your point about resilience, it's like high rises were built to sway in the wind, and when we have challenges, there are opportunities for growth and healing. And part of mindfulness is having a growth mindset. And so I love mindfulness practices like meditation. I like apps like Calm and Headspace, and yoga is meditation with movement. And when I went through clinical burnout years ago as a mom dealing with younger kids and aging parents and my own business, I turned to mindfulness meditation and to yoga, which I found that practice on the mat really is meditation with movement. And it teaches you that you can breathe through discomfort. And in the end, you're going to be stronger, more balanced, more flexible, and more resilient. So therapists work with clients on our self-talk, because the research shows that our thoughts precede our emotions and behaviors. So when we have negative or fear-based thinking, it fuels anxiety and depression, and it carves neuro pathways in our brains. And we can change those patterns through CBT exercises. And I find therapy to be something really self-compassionate that you can do for yourself. Again, I think we all can benefit from it at different points in our lives. I definitely called my therapist for a tune-up during the pandemic. And I'm a mom of teenagers. The research is showing that young adults and teenagers are the most impacted by the pandemic in terms of a mental health perspective. So talk to your loved ones, talk to your friends, talk to your partner, talk to your kids, talk in your workplaces about mental health. And if you identify some of the signs and symptoms in yourself or your loved ones that I share on my landing page, suggest someone that they seek counseling or therapy. It, again, is something really healthy and normal. And I'm going to share a couple resources of where you can find a therapist. If you are in one of the 7 states that Urban Balance is in, there's that website. There's over 160 providers. It's insurance friendly. If you're not, Psychology Today is like Match.com to find a therapist. It has our profiles and information, and you can find somebody that's a good fit for you. The biggest predictor of success in therapy is if you like your therapist. So if you feel like they're someone relatable, who you feel safe and comfortable with, who understands you, that is almost more important than their clinical training or background. A lot of people ask me, when should I start therapy? How do I know if I need it? Just go for a wellness check. We all need it at different points in our lives, and find a person to have in your corner. Don't wait. We don't wait for needing a root canal before we see the dentist. We can go preventively and proactively. And so I hope that you'll give it a try, and, let me know if I can be a support or a resource in the process.
Yeah, I think that's great. And I think, we often will co-treat with, we co-treat with a lot of different physicians and clinicians. And I think therapy is a really great hand in hand. To me, are much like yoga is the physical manifestation of the mental, so is acupuncture. And so, I'll have a lot of my runners, for instance, who will come out of a session feeling like they just went for a run, or, my really anxious patients who feel like they finally got to sleep through the night, even though they were on the table for half an hour. So I think that acupuncture is going to work in a very synergistic way with therapy. And that's why I love having this conversation. And I think it's really important that when you're seeking treatment, I agree, finding somebody that you jive well with, that you connect well with, and also being consistent with it is really important, right? You're creating a new habit here. And in order to do that, your body needs to get comfortable and get used to it. So, sometimes people feel a little uncomfortable the first time. That's where you communicate with your clinician, they'll probably sense it, truthfully, but if for some reason they don't, if you're really good at hiding, communicate that with them. We're here for you. My job is not to look good. My job is to get you to feel great. And then, as we're kind of working through your issues, then we can start thinking about the long term and how this is part of your larger journey of wellness, right? So like you were talking about, Joyce, with going in for tune-ups. I like that concept. I think about that a lot as well. It's we're just making sure that things are still moving in the direction that you want them to go. And that's where I really feel like having some consistency initially, and then moving to spreading things out a little bit can be really helpful for your body to maintain its balance. So the folks that I've been seeing, oftentimes are by nature, I think our culture, we just tend to come in when we're in crisis mode. We just tend to do that. So even with root canals, I love that example, because so many people I know who get root canals wait until it's too late almost, it's just, it kind of is our culture. We have other things that, that's not as important. One of the most beautiful things that has come of this difficult time is that a lot more people are prioritizing their mental health. And sometimes because they have to, because they burn out or they break down. And sometimes because they see others doing that and they don't want to do that. And sometimes things just have come to the surface and they're like, you know what, it's time to work on this, and who can help. And I think, the psychologist and an acupuncturist are 2 great people on your team to support you through this time.
And I think too, like developmentally, where you're at in your life makes a difference in terms of your hormones and everything. Like, for example, I just turned 50 and I'm having some premenopausal symptoms. And so I saw Eric in the Evanston office for acupuncture, and I told him I'm starting to have some night sweats. And of course, there's mental health issues when there's hormone changes as well. And he said, oh, that's going to take a few sessions. And you know what? After one session, I didn't have a night sweat for 3 weeks. So that taught me I needed to see Eric regularly. So yeah, we just need to take care of ourselves and prioritize our self-care so that we can move gently through all this change and uncertainty that has been thrown our way. And that's not selfish, it's essential. I used to think as a mom that I prioritized everyone else before me, but then I got exhausted and depleted, and that's not good for anyone. So I hope everyone will take the message that you deserve support, mind, body, spirit, and it's available, effective, and affordable.
Absolutely. I also think it's important to remember that, one of the cool things about this time too is people have tried new things. We've had so many folks who've never even thought about acupuncture before try it. And we want to make it as accessible and comfortable as possible. So at Align Modern Health, we do free 15-minute consultations. And what's great about that is you get to know somebody. You get to see if this is a good fit. You get to see if they've had experience with this, what their experience looks like. We want to be really open and honest about what we can and can't do. We work in coordination with folks. I don't want to be your therapist, but I will absolutely work with your therapist. And I'll be, maybe more of a body therapist from that perspective. So I think that, now is the time to take care of yourselves. Exactly. If you're not taking care of yourself, it's hard to take care of others too. So, your story, Joyce, is that of most healthcare practitioners, I feel like, and mothers and parents. You kind of put yourself last. And my hope is that we're starting to appreciate the benefit of putting ourselves first for a little bit to help then the larger community.
Dr. Camel, Joyce, thank you so much for this amazing conversation. We're getting some really great comments of gratitude in the chat. We'd love to ask everybody that is with us to ask any questions at this time for either Dr. Camel or for Joyce. Please type your questions directly into the Q&A feature on Zoom. We do have a few that we can start with. There is a question here about the links, including the links to the presentations for the landing page and some of those other resources. Those links are all in the chat, so please just scroll up in your chat box and those links are there for you. Joyce, our next question is for you regarding that landing page with all of the great resources you shared. We have a question here. Thank you very much for these resources. If I enter my email, is my information private?
Yes.
Excellent. Thank you so much. Dr. Camel, our next question is for you. It's basically asking for a little bit of information about how acupuncture works and how it can help with stress and depression and anxiety.
Sure. So there's a lot of different ideas of how acupuncture works. There's a lot of different research out there supporting different concepts of the mechanism of acupuncture. At a very basic level, when we're talking about how acupuncture works, we're talking about increasing circulation. So circulation, we're talking about blood flow, right? And within the blood are, as Joyce was mentioning, hormones. All the hormones in your body are going to be flowing through the body, through the blood. We're also impacting the nervous system. So we're impacting, by creating this little micro trauma with this tiny little hair thin needle, it's signaling the brain that something's going on there, triggers the nervous system to send signals to the area to figure out what's going on. Some of the really interesting basic science research talks about how specific acupuncture points have impacts on the nervous system specifically. It has impacts on the release of neurotransmitters, the release of endorphins. So one of the most common side effects, which, who doesn't like a positive side effect, but one of the most common side effects of an acupuncture treatment is relaxation, because what we're doing is activating that parasympathetic nervous system, the complement to the sympathetic fight or flight. So one of the mechanisms that we talk about is activating the vagus nerve. And that is a big part of the parasympathetic nervous system. So calming, quieting the mind, and reminding the body what it's doing is we're not sedating you. We're not giving you a pill that is a sedative. What we're doing is reminding your body that this is its nature. Your nature is to not be fighting constantly. Your nature is to be able to activate that as necessary, right? If you're crossing the street in Chicago, I'm in Wicker Park here. If I'm crossing the street on Division and a car comes at me, I shouldn't probably just stop there and watch it hit me, right? I should probably run and then maybe scream, we'll see. And that's supposed to happen, but we shouldn't be in that state all the time. And so some of the really interesting research, and certainly what we see clinically, is we're activating that rest and digest aspect of our natural system to reset, to quiet ourselves down. And so most people, as Joyce mentioned as well, walk out feeling really relaxed, feeling comfortable, as well as obviously seeing shifts in where their chief complaints are.
Thank you so much. We did have a follow-up question come in as you were speaking. Someone asked specifically, they are a lymphoma survivor. Is acupuncture safe for her?
Yeah, I saw that. Thank you for asking. In fact, acupuncture is in quite a few hospital systems, particularly associated with oncology. So not only do we treat during active cancer and treatment in coordination with your oncologist, but we will also treat post any sort of as in your refractory period or as you're healing. So absolutely, a big part of what we're doing is in that initial time that we visit with you, that first visit, we're going to spend a lot of time getting to know your full health history, because that's really important. If you're a survivor, we need to know that. We also need to know if you've had previous experience, and we also want to know things about your digestive system and your sleep and your pain, because all of these things are connected. We're looking at the body as a whole, not just one small thing. So yeah, absolutely, it is safe for you, and we would communicate with you specifically and talk about how we would tailor our treatments to you, because really acupuncture is at its very essence an individualized medicine.
Wonderful, thank you. Another question, which is general and great for everybody to know, will this recording be available? Yes, absolutely. Everybody who has registered for the session, whether or not you are able to attend live today, will be emailed a full copy of this recording. We also got another request for the landing page that Joyce shared. Scroll up in your chat, it is there for you. If you don't see it, it is www.joyce-martyr.com/aligned-modern-health. Joyce's contact information is also here on your screen. If you have questions for her directly about any of her activities, you can email info@joycemartyr.com or give her office a call at 312-344-3482. But again, if you scroll up in your chat, you should see all of the amazing resources that she shared, including that link to her landing page with those additional resources as well. Dr. Camel, we have another question about acupuncture. Can acupuncture help regain your appetite lost during the pandemic?
Absolutely. So there's a real clear, I just did an Instagram live about this last week with one of our functional medicine doctors, the clear connection between the gut and the brain. And so it's interesting when folks are in high stress, I'm sure, Joyce, you see this all the time, oftentimes they'll swing to one end of the pendulum or the other. So either they'll eat more or they'll lose their appetite. And so that is something we treat very frequently, and it's very much connected to anxiety and stress. And so if we're treating the root of it, we're going to be able to impact both. So for sure, generally when loss of appetite, we tend to see that from the perspective of post-chemo oncology folks. So we treat that a lot, but absolutely when it comes to the emotional aspect of that, that's something that we see very frequently. And I can personally say that I've seen a lot of in these last couple of months, a lot of weight loss because of everything that people are going through right now. So absolutely. And then it gives us the opportunity to start talking about what are the things that are really nourishing and particularly nourishing for you. Everybody's nourishment is going to look different, right? Just like everybody's emotional nourishment looks different. All of that is going to shift and be unique to your particular person and where you're at that time, right? Because just because we're the same person doesn't mean we're the same person we were 2 years ago, right? So we're always evolving. And so both, that's one of the things I love about therapy actually is that it's an evolution, and it's taking into account this individual in front of us, right? So we may be using similar techniques, we may even use some similar points, but it's going to be tailored to who you are. That's always going to, and as you adapt and as you evolve, we're going to be tailoring to that as well, right? Because our goal is to keep you motivated and moving.
Wonderful, thank you. I think we have time for one more question, and this is going to you, Joyce. I think this is an amazing question, and I really appreciate that it was asked. Do you have any recommendations on helping convince a friend who may be too prideful that they deserve therapy, or maybe general recommendations for folks that do still feel a little bit of that stigma that you talked about previously?
Yes, I'm so glad that that person asked the question as well. And I just shared an article that I wrote for the Huffington Post. It was picked up by another website, which I just put in the chat because I found that first, but it details some suggestions about how to recommend therapy or counseling to someone. I think the important thing is to define your role. Your role is to be empathic and compassionate. So to express love and care and concern and not judgment, and to state what you notice. Oh, sorry, Dr. Camel pointed out that I shared not to everyone, so I'm going to repost that article. So you don't want to judge the person in any way, but to say factually and objectively what you're observing. I noticed that you don't seem quite yourself lately. You've shared with me that you're not really wanting to get out and see people, or you're not connecting with your friends or your loved ones. And I'm wondering if therapy or counseling might be helpful for you. I think if you state that you yourself have found it beneficial, or that you yourself have gone, that's really normalizing. To explain that it doesn't have to be long-term. It can be, just a wellness check. To get some support and resources and tools, and really just be the bridge. Give them the resources like to Psychology Today or Urban Balance. A good place to start is with a therapist or counselor. And if medication might be something that is recommended, the therapist or counselor can provide a referral to a psychiatrist who provides mental health medications. And mental health medications can be life-changing and life-saving. So I don't think you'd argue with your cardiologist if they recommended some blood pressure medicine and things. So just being really open, the more you normalize it. I love when celebrities come out and share that they've dealt with issues, because again, I think we all do at different points in our lives. So care enough to say something. I think sometimes we're socialized that it's impolite to comment on somebody's mental health, but it actually is the more compassionate thing to do. So I wish you good luck with that, and check out that article. I hope it's helpful for you.
Thank you so much. Thank you both, Dr. Camel and Joyce, for joining us today. Thank you to all of our guests who have joined us live as well. Again, if you do have more questions for Joyce, please reach out at info@joycemartyr.com. If you are interested in more information about Aligned Modern Health, the free 15-minute consultations that Dr. Camel mentioned, or perhaps you'd like to check into your insurance benefits to see what kind of coverage you have, please feel free to give us a call directly at 312-216-2452, or you can visit our website at alignedmodernhealth.com. This does bring us to all the time that we have for today. Thank you again so much for joining our Aligned Modern Health digital doc presentation on a conversation on mental health. The next digital doc presentation is coming up on February 9th, and that will be on heart health for Heart Health Awareness Month. Thank you so much. Have a great day. Cheers.
Thanks, everyone.
Thank you.